Hi, everyone. My name is Julie Roth-Novak. I'm the CEO and co-founder of PartySlate. I feel like I'm out of practice with my webinars because I had a little bit of a break where we went back to some real events in person. And we felt this topic was so important for the community that we are back on the webinar. We're probably going to be hosting quarterly or monthly webinars moving forward, just because it's a great way to augment our in-person events. But I just wanted to welcome everyone to this very important webinar on a very timely topic. We've had some topics before about testing and screening, but so much has transpired and improved over the last 6 to 9 months in this space. I'm really, really excited to have an incredible panel of experts here to talk about how to really implement the best COVID protocols to host safe events, which include screening and testing and lots of communication. And they know so much more than I do. So I am excited to, without further delay, introduce this incredible panel. So I'm going to start with you, and I'll go around the room here. Dr. Min, can you quickly introduce, well, not quickly, but introduce yourself and the company you're working with, and tell us a little bit about how you got involved in this space.
Oh, sure. So thank you so much, Julie, for organizing this. I work at the Event Doc, which I started with Steve Pastor, and I'm a physician as well as scientist. I have a medical degree as well as a PhD, and I am Steve's doctor buddy, and I knew he was in the event industry, and he came to me with the issue that when we were first talking about this, which was over a year ago, he was envisioning the day. Of course, at that point, literally the event industry did not exist at that time, but he envisioned that there would be a day when we'd go back to it. And even when we were allowed to do it, that people wouldn't feel comfortable getting together. And so we needed to figure out a way to reassure people that events were safe. And we started talking about how that can be achieved. And that's what we started with the Event Doc, with an on-site testing service designed for events. That's enough about me, but anyway, and so I'm serving as the Chief Scientific Officer for the Event Doc.
Great. Well, we're going to have lots of questions for you. So I know Steve is actually on site doing testing real time. So he's going to be coming in and out, but we'll have actually reports from the field at an on-site testing center. Steve will be waving. I'm not sure how much he can be participating as he's actually doing live testing, but Steve started the Event Doc, as you mentioned, with you, Dr. Min, and has been really at the forefront of on-site testing. Steve, did you want to say anything or do any intros, or we can pull you in later?
Let's chat later, because I have somebody here that we're testing who might be
we'll pull you in
positive.
later.
So I have to concentrate on this.
Okay, great. We'll pull you in later. Jennifer, you are kind of like the other side of the coin, really helping with the screening process. And I know screening and testing go hand in hand, and I'm excited to talk about those, but tell us about who you are and your company.
Sure. Well, thank you so much for having me here. So I have been in the event space for nearly 21 years, spent nearly 2 decades producing amazing events. And like everybody else, really, looked to pivot over time and grow my business. I became a tech founder of VOW. VOW is a company that is dedicated to technology for event, meeting, and hospitality pros everywhere. We were building a real-time communications platform before COVID. And when COVID hit, it was really a unique moment in time to say, how can we take the tech side? How can we take the live event side? And how can we solve pain to help people get back to revenue, get back to life and live? And so we did just that. We actually started building VOW Digital Health back in September, October. It was really amazingly the exact product it was today. It pivoted with every inch of pivot the landscape took. And so today we are here as really the only force in the country that is the first B2B platform, COVID clearing at scale, purpose-built for our ecosystem. So everything about it is juiced to servicing venues, vendors, organizers, hosts, and clients alike. So that's what we're doing. It's exciting to be here.
I have to thank you because we used your product for our first in-person event in Chicago, and it was seamless and easy. And we were worried about drop off. We didn't have drop off, and it was a really, as a client, it was very easy to use. So thank you for all your hard work. Ryan, let's tell me a little bit about you and your company. I know you actually reconnected me with Jennifer, which I appreciate. Tell us about who you are and a little bit about how you got connected with this group.
Sure. Thank you, Julie, first of all, for having me. This is a great group of people and colleagues to be on this panel with, and I'm super excited to be here. I'm the CEO of Apotheosis Events, which is a New York-based event planning company with, we like to say, a uniquely theatrical commitment to creativity. So I'm a planner in the space. Lately, most of my time has been spent using either VOW Digital Health or EventDoc for my events. So thank God for Jennifer and Steve for creating useful tools that planners can use to keep our industry in motion when so many other people are looking to either cancel or delay. And the thing that we've been saying most lately is you don't have to. The event world has come together. We have created products that we can use, and we can keep events going.
Yeah, where we've come for the last year, Ryan, I remember we did a webinar with you last year. We've come so far from our knowledge, the tools these guys have built, the expertise. Clearly with vaccine is a game changer, but we still need to host safe events. And you, Ryan, especially, I hear from you over and over how the importance of that communication piece with your clients, the education. So thank you for being with us.
Yeah, absolutely.
Yeah, and Mark, last but not least, I love you bringing the perspective from a creative partner on these big events. Tell us a little bit about who you are and your company.
Well, thank you so much, everyone, thank you, Jennifer, for inviting me, and Steve, thank you for hooking me up with this amazing panel. So my name is Mark Wilson. I'm the creative director and founder of the Style Mark. We're 25 years in, and we're still here. Really happy that we're all still here. I'm happy to see this group. We're a full-scale event design and production studio, both nationally and internationally at this point. And I'm just really super excited to be here. We actually worked with Jennifer earlier this year, and I can say that it was a very beautiful, seamless experience. Thank you for that. So we're excited to have that conversation from the event side, from the event planner, event designer side, I should say.
Awesome. Well, thank you guys for being here. And in the chat, please, if everyone could say where they're zooming in from, would love to hear. I see we have a bunch of our friends from the East Coast. I know some people from the West Coast are here as well, and many, many others who will be listening to the recording. So I wanted to start it with you, Dr. Min. There is so much discussion. I look at the New York Times every day on the rise of the Delta variant, the effectiveness of vaccines, new ways to encourage people to get the vaccine, and then of course all of the event protocols that are happening. Tell us from your perspective a little bit, about the Delta variant and the effectiveness of vaccines and why it's so important to augment vaccines with testing and screening.
Well, first of all, I do want to pre-specify that this is not an established science. We're learning. What we do know, there are things that are hard facts. We do know what mutations are involved in the Delta variant. We know that it's highly infectious, much more infectious than the original coronavirus. But there are some aspects of this that are still being understood. But I'd like to first start off by reassuring everyone that based on the data we have so far, that the vaccines continue to be effective for infections involving Delta variant. So there is no reason to think of vaccines as being less effective. However, as I think everyone knows, for example, there was a detailed analysis of Provincetown that you may have heard of, and they had a big July 4th celebration because we were done with COVID, as you may know. It was a maskless, everyone having a good time. We thought, we were past all this, and we were sorely mistaken. And you may know that that more people who are vaccinated were infected with Delta than people who are unvaccinated. And that's mainly because most of the people who attended were vaccinated. It's not that people who are vaccinated were more susceptible
Right.
to infection. It's just that if 90% of the people who attended were vaccinated and only a small percentage of them got infected, they're still going to outnumber those who were unvaccinated. So the vaccine still is very effective. It's still the fact that something greater than 90% of people who've been vaccinated and who get infected with Delta remain protected from going to the hospital. The thing that shocked us as scientists was that those people who had these breakthrough infections, although they had milder disease, had the same viral loads as unvaccinated people. So they could spread it just as easily as unvaccinated people. That was a surprise to us as scientists. And so I would, encourage everyone to continue to consider vaccination. If you haven't been vaccinated, I really encourage you to get vaccinated and to protect yourself and to protect the people around you.
Absolutely. And so because of the rise in Delta, we are back to thinking about, we want to celebrate, we want to have, especially on the social side, but I also see fundraisers and other people wanting to have celebrations. It really does bring back the importance of, even if 100% are vaccinated, of still having testing and screening protocols, and also, on-site, if it's inside, masks and things like that. So maybe you and or Steve could talk a little bit about, how does the event doc work? So let's say I'm having a big corporate event. We are working with you guys for our New York event. How does it work? How do we sign up? What does the guest experience look like? Tell us the nuts and bolts of the event doc.
Steve, are you free to address this one?
I have another 7 minutes left on a test press, so if you wouldn't mind, if you could give a overall, I appreciate it.
Yeah, and you're going in and out.
Your connection is a little bit spotty, so I'll go ahead and field this. I don't want to take up all the bandwidth and airtime, but so when you work with us, we're really, first of all, our core thing that we bring to your event is the ability to test your attendees and make sure that everyone who is in the venue is actually COVID negative. And but what we have as part of our service is then an ability to have people check in and have and one of the things that we do, one of the first lines of defense that we do is we do what's called rapid antigen testing. And we choose to do that as our screening test because it only takes 15 minutes. And so when an attendee arrives at the event, they don't go straight into the venue, they go to the testing site. And at the testing site, they are tested, and then they have to wait 15 minutes, which is as fast a test as you can do currently for COVID. Although that is fast, we have found that when all you're doing is, and there's the Binax test that we're using currently, and we have found that 15 minutes is an eternity. So what we do with our organizers is try to figure out a way to make that testing center not some sterile laboratory environment, but somewhat a part of the event itself. And so we try to work with you to make sure that it's a welcoming place, that people feel comfortable, that, ideally, if there's some place that you can relax and things like that. And then we recommend that, for example, if you have a cocktail hour, we don't have people go to cocktails without having been tested, but we recommend that you extend that cocktail hour, let's say, so that you have the time that you can space out people so that they can get tested before they enter the actual venue. And that way, try to manage it in a way that people feel comfortable and that it's not some strange part of the separate part of the event, but that it's all embedded within the event, so that as much as possible, people feel that they're being a part of the party, even at the point where they're being tested.
And we do have a question about how effective or how reliable are the antigen testing for DEA? Like what percentage are false?
Right. So I'll address this in two layers. The first thing I want to just address is in terms of the accuracy of testing in the face of Delta variant, because we get a lot of questions about that.
Yeah.
And it turns out that the tests are as accurate for Delta variant as they are for the regular virus.
Mhm.
And the reason for that is that the tests detect a different protein. So you may, if you've been following very closely, coronavirus has a spike protein, and that's how it enters our bodies, our cells. And that spike protein is the one that changes with Delta variant. But our tests actually detect other proteins of the virus that don't change with Delta.
Okay.
And that's why the accuracy doesn't change. The fact is that the rapid antigen test is really accurate. To be frank, the rapid antigen test is not actually designed for screening for something like a party. It is designed for making a diagnosis of COVID in someone who's feeling sick. So in fact, it's not been tested in people, because if someone comes to your event who's literally feeling sick with COVID, I think that you don't want them on, if you have friends like that, you probably don't really want to associate with them. So the person who's at your event is not that symptomatic, feeling like they have COVID, and now they're getting tested. So that person who's feeling fine, as you may know, may have asymptomatic COVID. And the fact is that there's no data about the accuracy of this test with regard to that. What we know is for symptomatic people infected with COVID, the test is highly accurate and highly sensitive. And what we don't know is, in fact, how it performs in asymptomatics.
Mhm.
So it's not a perfect test by any means, but there is no such thing. It's the most practicable test that you can use. And we use it to try to do our best to make the event as safe as possible. But I tell people when I'm testing them, and this goes into how you conduct yourself at the party, that you continue to use as much of the safety precautions as you can. And so when I test people, I tell them, the good news is that everyone who's in the venue has been tested negative, but I am not telling you there is no COVID there.
Yeah.
So,
It's
as
an
much
extra
as
layer of precaution, but you can't guarantee that there's.
correct.
Oh,
And
right.
we say, we recognize this is a social event, that you are there. By definition, it's generally involves having drinks, having food. You're not going to be able to maintain a mask through that whole event. But we advise people, to the extent that is possible, use your judgment, try to be as safe as possible, use social distancing, use things like masks when you can, but that we are not guaranteeing that there's no COVID there. We're doing
Yeah.
our best to eliminate it.
Yeah.
You cannot look at our negative tests as saying, I can just do whatever I want.
Right. Well, that's a good transition. Or Ryan, do you want to jump in? Because I want to jump to Jennifer after that. Yeah.
Well, I just wanted to say, because I think that some people could benefit from the clarification here, and it's really a question for Dr. Min, which is that what my understanding of the rapid test is that it's testing for a person who is actively shedding the virus at that point. And so the nuance there that I think could be helpful for people who are watching is you're testing with a rapid antigen to find out if someone is actively shedding virus. So that person is the most dangerous person to have at an event. So the rapid test tests for that, and we obviously are not admitting them, is a person, and this is, I think, the nuance that most people get tripped up by with the rapid is, if a person is not shedding virus at that point, but may be positive for COVID, how do you feel about saying, are they less contagious to others or the same? I think that's what people don't understand.
So you're exactly right, Ryan. The amount that you're shedding determines how well I can detect with the rapid antigen test. However, what we don't, the problem is that someone who's shedding some virus, but not enough to be positive, could still infect people. So again, it's not zero chance.
Yeah.
But to your point, we are detecting those people who are like shedding lots of virus and who would create a super spreader event. Those are the people we're eliminating. What I can't guarantee is that someone who's shedding a bit less might be in there and could still infect people. So.
Great. And I can tell you from experience, I spoke at David Tutera's event down in Orlando, and I experienced the testing. And it was in advance of the event, before the opening party. There was plenty of time to go through the testing, to check into your hotel room before going to the event. And so I do think you guys, in partnership with the planners, do a really good job of making it seamless. So Jennifer,
Oh.
go ahead.
I just wanted to mention one last thing.
Yeah.
Aside from the sensitivity, one other challenge with the testing of the rapid antigen testing is that a positive test could be a false positive.
Yes.
And so the way we deal with that is that we back that. So we don't tell people you have COVID. We tell them they have a preliminary result from the rapid antigen test. And then we do a confirmatory molecular test.
Mhm.
And if the molecular test reads out as negative, we consider that a false positive from the antigen test, and we can let that person into the party. It's another 30 minutes, which
Yeah.
is not great, but
Steve
at
has a
least-
visual aid there.
Yes.
Thank you, Steve.
except that he's a little
It's upside
challenged.
down.
Yes, he wasn't the brightest kid in school. That's why I'm the doc, and he's,
Yeah.
I'm just
Got it.
kidding, of course.
I've taken that test.
Awesome. And so, so to complement what Dr. Min is talking about on-site testing, Jennifer, tell us about screening. So I think there is confusion about, you can do screening, you can do testing, you could do one or the other, or you could do both. So tell us about, and you're on mute, Jennifer, tell us a little bit about how, let's say I'm a new client and I want to do screening, how your product works and helps streamline the process.
Sure. So thank you again for having me. So a couple of things. The way that we look at the landscape right now is that there's three main tools in the toolbox that you can use to reduce risk and have a safe event. So you have testing, you have screening, which is what we do. We look for proof of vaccination, which we know reduces both incidences and reduces the likelihood that you would become ill. And then we look at screening of tests. So we're taking over a process that people would do paper driven or an email, and we're doing it in our app at scale. So you have testing and you have us, which is screening. And then you, of course, you have masks, right? This is kind of the trifecta. And so every layer that you add in is one more layer to help you reduce risk, get those butts in seats, make sure you drive the numbers, have revenue, and can gather with comfort and confidence and joy. So it's a chicken and egg, right? If you have screening and or you have testing, then your guests, your attendees know that there's a rinse and repeatable processing happening to reduce risk. Now, there's a lot of debate and things we can debunk about the vaccines, and Dr. Min spoke about it. But what the world is saying is that gathering safely is in part about proof of vaccination. That doesn't mean you won't have spread, doesn't mean people won't become sick, but what we are tracking towards is that the reduction of people who are getting ill or hospital bound is very, very minimal, right? So to his point, we're all living through what I would call one worldwide beta. We're part of it. It's happening real time. So we don't have science in mass on our side, but what we do have is some practicality on our side. So with every event that we screen, that Steve tests, we see that this works. Yeah. We see that even in partnership together, it creates stronger bones. And then when you do add in mask wearing, it could be for your vendors and collaborators where possible. It could be maybe for some of the guests or children who could be carriers. You add in another layer. So these are different tools that in combination or independently can be used to really get back in action, to get back as we go inside, get into the fall, make sure events don't cancel. So there are great tools that everybody has at their disposal.
And can you walk just through the flow, the people that haven't used your product before?
Sure.
So let's
Absolutely.
say I'm invited to an event. Tell me kind of what my experience would be and what I need to do as a guest.
Sure. So the app is business facing, meaning there's nothing just the average, civilian can jump on and do with it. You get invited in. You get invited in by a host or an organizer, by a venue, vendor, or collaborator. You are invited into what we call a health protocol. A health protocol is what is your game for COVID? Is your game testing? Is it vaccine and testing? Is it vaccine or a test? We have what I would call a McDonald's menu of every single scenario you could possibly come up with inside the app. You select it, the app goes out and communicates with your guest by SMS or email.
Mhm.
They set up a secure account. They upload proof of identity in the form of an ID or a government issued document. They upload proof of vaccine, if that is what is required, and or a test. We clear it and we clear them to enter. We're also working on a number of solutions for event organizers, venues, and vendors at the point of entry.
Yeah.
So what's important? What am I passionate about? People need to go to events, not COVID events.
Mhm.
If they're COVID events, they're not going to go.
Mhm.
So we are shortening the number of steps for guests as they have to provide proof of test, proof of vaccine, proof of identity. So we can get this stuff out of the way before they get on site. We don't want hundreds of people waiting at the foothills of a venue who may or may not have the right documentation, where organizers and venue staff are becoming bouncers. We want people to go, like clear and go.
Yeah.
So the app does that, and we're working on some new great solves where states like New York, Massachusetts, California are moving towards proof of vaccine and ID everywhere. We still don't want them to be card-carrying members on site. We want it done in advance. So we're stepping through legal and tech and all the good things to continue to pivot and solve these problems at scale.
That's amazing. And I will say again, from using your app a couple times for events, once you use it, it actually is that much easier for the next event. So I personally don't like doing forms and scanning and all that stuff. And you made it really easy, especially if there's repeat events. So I think especially for our industry type events, once you're cleared with at least with the vaccine pass, which is great. And so let me go on to, I want to talk to Ryan and Mark, and then I'm going to come back to you guys about working together on events. But Ryan, we talked in advance of this webinar how important it is. People are starting to feel a little bit lost again or unsure. Very different than the first time when it was chaos and no one knew what was going on. We're a lot smarter. There's a lot more people vaccinated. How do you lead your clients through the decision on, number one, hopefully not postponing or not canceling, and then number two, the COVID protocol for their event?
Sure. I mean, I think the interesting thing is, Julie, earlier when you said the rise of the Delta variant, I was like, that's the movie that no one wants to watch, right? It sounds like a horror film. And if you think about it in that way, you know, at the beginning of a horror movie, about the time that everybody starts to realize that something's going wrong, you always have the character who starts to try and get ahead of the game, right? To try and start to plan around the terror and plan around whatever the monster is. And so you start to think about mitigating risk, right? And that's where I start with my clients now, is we cannot eliminate risk. If you want to eliminate risk, stay home. Like, never leave your house, don't go to the grocery store, don't get in your car. Driving your car is a risk. You know, like, you can't do anything. You just have to stay still if you want to eliminate risk. We live in a world that is about educated guesses and making smart choices. And so when clients have come to me recently and said, we don't think we're going to do this, I said, okay, but why? You can. We are not in the same place that we were a year ago. We have a lot more information. We have a lot more tools. Why aren't we using them? I really said to my clients, this is an opportunity for you to be a leader in the space that you are working in. Everyone is thinking the same way that you are. So why don't you be different? Like, let's be different together. We can do this. For one client, I'm using Jennifer. For the same client, I used Steve's company for a separate event, but related to the same large event. And what we've been talking about with the clients is, what are the ways that we mitigate risk? So we use VOW to screen people in advance. And then we either come up with a scenario where we are testing people on site for the same event, knowing that people have been cleared through the VOW system. Then we can bring in Event Doc and we can test people on site for the same event before they go in. That's 2 levels of security that we've just given you. Or we can figure out a testing strategy that is more nimble than on site by getting tests to people in advance, or simply telling people, if you want to come to this event, if you want to participate in this premiere, you are going to have to find your way
Yes.
either into getting an Abbott Binax Now test that you can do in your home that's proctored by a person on a screen that watches you do it and gives you a result via a QR code or an email that you can then submit to VOW that tells me that you tested, or you're going to have to take yourself to a doctor's office.
Mhm.
But we live in this world now, right?
Mhm.
We live in the world of the rise of the Delta variant. That's not changing and it's not going away. And Dr. Min has said some things about the numbers that we need to get to where with vaccination, where we really start to see a decline in the rise of the Delta variant, which would be the sequel that I would like to go see. But you really have to focus on letting people know there are tools, you can use them. If you
Yes.
choose not to use them, I don't know what to do for you, because the world is not going to change back
Yes. I
as
agree.
quickly as it changed. And so we have to adapt. We have to find new ways to do this. And these are the ways in which we do it. And I was confronted with 3 events that tried to cancel. All 3 of them have just recently signed contracts now. So we're moving ahead. The world is spinning forward. And I think it's all of our responsibility in the event world, from Steve to Jen to Dr. Min to planners, designers, photographers, everybody, to know that these resources are out there, because I'm not always going to be the person talking to a client. Sometimes it's going to be a photographer that they meet at a wedding. And
Yeah, we all need to be educated about
yeah,
that.
I need the photographers to know. I need the
Yeah.
designers to know. I need everybody to know, so that they can know you don't have to cancel your events. You can talk to X, Y, or Z, but we all have to educate ourselves, because the information.
I agree 100%. I'm going to come
Yeah.
back to, because there's some
Sure.
questions about cost, and then Dr. Min, there's some questions about who gets these results and privacy and all that. But before I move on to those questions, Mark, I'd love to hear your experience. Ryan talked about the importance of creative partners, understanding, and also being educated, being able to speak about the safety protocols. Tell us your experience with recent events. I know you've partnered with many of the people on the panel on hosting or being part of safe events.
Thank you so much. I can't share, Ryan, thank you, because I agree 1,000% with everything that Ryan is saying. It's like we cannot stop doing events. We just have to be smart about how we're doing them. I've actually had the opportunity to work with Val and Jennifer earlier this year. For me, as the vendor, as the event designer, I'm fortunate enough that we can come in early, and before we had all of these processes in place, I actually asked my vendors and my clients that we would go in separately before anyone else. I make sure that all of my vendors and all of my staff have been vaccinated fully. And if they have traveled, I ask them to go test again before they come back into the studio, before they go on a job. So we have a unique position where we're able to go in quickly, design what we have to do, lay it all out, clean it up, and get out long before anyone else gets there. It's kind of been my mantra these days. I'm like, we're in first or we're out first. But we had a wonderful opportunity to work with the VOW Digital Health, and my team actually was really happy that we had done that for them. They felt even more secure, that extra step, that extra layer of protection that they felt they could, because at this particular event, there were more people around us as we were setting up and doing this. So they felt really comfortable doing that. I think it's really important that, at least for me and my team, and I think for people on the event side who are the vendors, that we're really paying attention to making sure that our staff and the people that we're around are safe, and utilizing these platforms is an easy fix. It's easy to do it. And I've actually shared now with some of my clients both of these platforms, and said to them, because they didn't even know about your platforms, guys. And I'm like, you guys should be looking at these platforms to move forward, not just for us and our safety, but for everyone's safety.
That's amazing. And we do have some questions. I'm not sure who to answer this, but maybe Ryan, you could, or Mark. Bob Conti, our friend out there, has asked, can we talk about staffing? It is awkward at times maybe, and hard to require, on-site, or I guess you're saying off-site, but I think you mean on-site testing. Is that the question, Bob, or I'm not quite sure?
You want to go, Brian, for me? Yeah, go ahead.
Well, I think that he means offsite testing, Julie. And what I think Bob is saying is that in regard to one of the things that I said, which is that if you're not going to hire Event Doc and do on-site testing,
Okay.
or as you're clearing vendors or you're clearing guests to come onto site, you're going to have to make sure that they are all tested before they come there. And that is, because I'm walking through it on 3 different events right now, it is a harder proposition. Is it impossible? No. There are some great companies out there who are willing to interface with vendors and send large batches of tests out to people. Jennifer introduced me to one of them. Thank God for her again, because she is just like batting it out of the park on a number of different levels. So I think that that's what Bob is talking about. Is it's a much different proposition, right? You either have to get tests to everybody,
Yeah.
which is not easy,
And
or
that's the offsite testing you're talking
yeah,
about.
offsite. Like this
Okay.
is, we're either sending you a test that every staff member, and sometimes we're talking about 200, are going to do at their home, or we are telling those 200 people, you have to find your way
Yes.
somewhere and get a test. And my response to that is that it is inconvenient, but this is the price of doing business right now, right? What's more inconvenient is having no events again, is
Right.
having no job.
And
So
talk about inconvenience and not having events. Like I wouldn't say inconvenience. A couple people have pinged me, both in the chat and question and answer, about pricing. I know we aren't going to go through a detailed proposal, but maybe at a high level, what are we talking as far as that people would need to set aside to allow for this type of testing and screening? I don't know who wants to answer.
Sure. I mean,
I can answer that.
Go ahead.
You know, can you hear me?
Yep.
Oh, okay. You know, if people put in a ballpark budget of $75 per test for a minimum of 50 people, that would be a baseline. It used to be a lot higher. The tests have actually come down quite a bit.
Mm-hmm. And Jennifer, what about your perspective?
Sorry.
Yeah, so we bucket things a little bit differently. One of the intuitive aspects to VOW Digital Health is that you can put your guests in one grouping and then your vendor and collaborator teams, venue and collaborator teams. So the way that we deal with vendors and businesses, super different. We sort of do it on a monthly recurring fee.
Yeah.
So that they can add their teams in one time.
Yes.
And be moving through tons of protocols, because vendors have to staff up and staff down rapidly.
Yes.
And so the goal is to shorten the number of steps in a particular set of workflows around this. For guests, we charge anywhere from $10 to $15 per person. And that depends on if it's vaccine only, vaccine or a testing option, which means 20, 30% of the group might be testing. And then 15 is for vaccine and a test. We do have multiple day events, multiple combinations, but that's kind of like the fix.
Okay.
And as we go to events of scale, we do offer scale discounts. And as everyone has heard me say, we've kept the pricing really consistent because everyone knows each other. But if you have a nonprofit, if you have a gala, if you have a fundraiser that needs some assistance, like we're going to do that. And if there's multiple events on the table for one particular client or organizer, such as a nonprofit, then we'll work with them as well. We want to help everybody get back.
Julie,
Go ahead.
oh, sorry. There's just a question that came in that I really want to, I feel strongly about addressing, which is a question that came in about where social events where the host has already reduced the guest counts and they know their guests and they're asking them to say that they're vaccinated and to do a PR test, but then asking them to prove it, is that somehow offensive? And I want to say that because I've just been through this with a client, like it has been perceived by people as, oh, you're asking me to prove it. You know, it's not enough for me to say that I'm vaccinated. And actually, the way that this client dealt with it, which is what I thought was so smart, was that they were saying is, this is not about me asking you to prove it. It's about everybody showing that they're vaccinated and taking these tests so that you feel totally comfortable at my event.
Yeah.
it's less about me asking you to prove it so that you can come
Yeah.
than it is about me asking you to simply say, I'm vaccinated, here's my card,
Yeah.
I've taken a test, here's my result, so that you can come to my event and feel completely comfortable and safe.
And
So
what
it's
I love, and what I love, if there's an awkward exchange, it's like you're working with a third party. It's a little less like personal, like, I don't believe you, I need it. It's like, this is the protocol, this is the process we're following. And I agree with you, Ryan. I think it's to make everyone feel safe. It's not about not believing someone. It's about everyone feeling safe.
yeah, it's about
Also,
uncertainty.
I
Yeah.
think there's also a number of high level points. When the industry got shut down, nobody had data. You guys didn't have the data. You didn't know the numbers. And there were people reaching out to everybody. We will have the data. We will know that we collectively, independently, with all these tools, have been able to push forward. If you don't use the tools at your disposal and you just sit back and you either don't do those events or you're doing things by hand, you know, one of the more powerful things one of our venue partners has been able to say, you know, they've cleared thousands through our platform. Now, again, we are screening, right? Steve is testing. So
Yeah.
he's testing that someone is proof of negative. We are just screening, but we have the data
Yeah.
that this does help us forge ahead. That data is really powerful as, you know, we go into the world, you know, after 9/11, unfortunately, from that tragedy, there are so many things that we now do at the airports. They cause us unbelievable inconveniences and they've stuck around to today. But we know that by doing this, we are more safe. We're not impenetrable, but we are more safe than we were at every step. So doing nothing is absolutely not an option. And for people who are doing nothing, you're really inviting challenges in. We have to get through inside. I don't care if you're on LA time or you're on East Coast or in Ireland, we need to get inside. We have to get through to Q1 of next year. If events cancel, that cancellation will be contagious.
Yeah.
So
And
doing nothing is not enough.
I 100% agree. And I think that there might be a future time when there's herd immunity and we're in a different position. But
Yes.
right now, you guys, anyone who reads anything, we're not in that position anywhere in the country. Yes, it's worse in
Fortunately,
certain places.
you know,
Yeah.
to that point, Julie, I just want to make a comment with regard to the epidemiology. You know, New York, as you know, we were, you know, and Provincetown again is another example. We were all patting ourselves on the back. We got to 70%. Before Delta variant, 70% was sufficient. Delta variant raised the bar.
Yeah.
We don't have a new number, but it's looking like 90+%, you know, is what you need to get herd immunity. And that is a really hard number.
Does that count the people that have had it already or not?
That gets into a whole other.
Okay.
I think the other point worth touching upon is for organizers who are doing this on their own and venues and vendors, right? When we were first looking at this in March and April, people had systems because that's what we do as event organizers. We all come up with systems, right? When you're doing this at scale and you're moving this to events of 500, 1,500, you're moving it to annuals, you're moving it to more corporates than socials, right? Socials, everyone says, you know, I've potted with my family all winter, right? But then it's bigger and bigger. And so what happens is people start to question. They go out the door, they send those wedding invites, there's no COVID health protocol in place, and then you start to get the emails.
Yeah.
Wait, hold up, you're not just proof of vaccine? Wait, are you asking everyone to get tested? Wait, am I going to be sitting at a table with people who are not vaccinated? We just did a wedding last weekend and there were at least 70% of the guests would not sit at the ceremony with people who are not unvaccinated. So people, they're polarized about this. So if you don't go into it, you know, head on, you end up backing into it, which is really cumbersome and challenging.
Yeah, we think the more proactive you are one way or the other about what you're going to be doing, how you're going to be handling it, the less, you know, pushed against the wall and you'll have to make a last minute decision that will not probably be, you know, cost effective and will not be good for your guests. I am getting questions about and I don't know, Steve, if you just had this situation on your on-site testing right now, is what happens when you get a negative test and let's say you do your second test and I mean, a positive test and it's positive again. So you're pretty sure that this person has COVID. So who finds out about that? What are the kind of HIPAA or other concerns, privacy concerns? And I can imagine it being incredibly challenging. I don't know.
Okay, well, that's a good question, Chris. If you don't mind, I'll answer that because I just went through it. First of all, when somebody has a positive test, I mean, what some of my competitors do is they text results because, you know, clients say, how quickly can you do this? How fast can you get us through the room? And I say, you know, we're not a velvet rope that we're getting you into a nightclub. We're doing a medical test, and there's a high touch moment that involves human interaction. I never text results because I don't want to text somebody that the results are positive. First of all, we don't say that. We say that the results are inconclusive. That's what, you know, Chris Min, you know, has come up with, and I think that it's the right thing to say. We don't want to overly upset people. Then we say when it's inconclusive, we're going to do a PCR test that will be definitive. The PCR test is 99.1% accurate. So, you know, Chris and our other doctor have determined that for all intents and purposes, if the PCR is positive, that person is positive. If they're negative, they're negative. So what we do before we start a testing process is that we ask the event planner, who on your team do we give a positive result to? And we recommend that only one person know about this. It's not a good idea for the team to be talking amongst each other. The nurses don't talk amongst each other. We don't mention it to the guests as well. We also ask if it's at a hotel or a venue, is there somebody on the venue side that you need to notify about this? Four Seasons is very strict about this, for example. Other venues don't care. So the form that people sign is a waiver that allows us to release their test results to a third party because it is a medical test. It's covered under HIPAA. So they are waiving their HIPAA requirements. We research this very carefully with our legal team that we are allowed to do this. So that's how we go about it.
Because if you weren't allowed to do it, it would kind of be counterproductive of doing the tests. You know, so you do have, right? Like if no one could find out.
That person would still know, and we'd ask them to leave. It's just that nobody on the you know, the event side would know why they left.
Yes.
But, you know, we're glad that we're able to do this.
There are also some, you know, we comply with the local regulations. So depending on where we're performing the test, there may be also regulations that require us to report to health authorities. And that's standard, you know, whether you get your test at a test site, you know, like on the, you know, like one of these rapid testing sites in New York City or in Florida or whatever. And we comply with all those rules and regulations.
Awesome.
One other thing to Chris's point, even if when we report a positive test, we do not give the local health authorities the guest list. That is proprietary to the event organizer. It is up to the health authorities to contact that individual who is infected to determine contact tracing. We don't provide a list for them to do that. That's not our role.
Okay, great. And then I was going to really quickly just share my screen to show, I think you did this with Cerbelli in New York, Steve, where you kind of did a test run of COVID testing to have a safe event. And so is this kind of how it looks here? It's a kind of either a table or chairs set up. What's the typical layout of when you're doing your on-site testing?
Well, we normally have 3 or 4 tables set up at a time because at all of our events, we have either 3 nurses or 4 nurses that are doing the test. So each nurse generally, from our experience, can go through 40 tests an hour. So we can very easily accommodate 150 people within an hour. So you know, Chris is there testing on a very small scale basis, you know, as an example, but normally when we're ramped up at an event, we normally have 4 different testing stations, sometimes 5 to get through, you know, as many as 200
You can do it in
guests
an elevated way. Even the Four Seasons has this. So
we try.
Yeah. And I will say, we're going to send out both the VOW and event doc information along with the recording as a follow-up, because many people have asked. And then again, if anyone wants to reach out to Ryan or Mark about their experience, we'll have their contact information as well. Anything else you want to share about the on-site experience?
Yeah, Julie, if I may, one of the things that when we started this business, I guess as Steve keeps emphasizing, this is medical testing. And we've been surprised at how our competitors operate. To me, we called it the event doc because this is a medical situation. Our testers are all registered nurses or actual MDs. And what I've been surprised by is that we're unique in the field. We do have competitors out there, and they just hire, and it is true that one can train someone to do a nasal swab. I mean, you can train a high school student how to do this. The testing itself is not sophisticated. In my opinion, what's sophisticated is the person who's actually at highest risk of getting COVID by doing the testing are the testing staff. And I insisted that we have healthcare professionals who do know about universal precautions and who will practice appropriate procedures, not just for the safety of the guests, but the safety of our own staff. And so that surprisingly to me is unique amongst our competitors. We're the only ones who only use healthcare professionals to do all the testing.
Wow. Let me ask, we have about 8 more minutes left. And if anyone sees any questions popping up in the chat that you want to answer, you can jump in. But I will say, I do get a lot of questions about, what do you think about the future of required vaccines, like what's happening in New York, to get into restaurants, to work at a hospital, to be a teacher, or there's all these new requirements coming. So there's both kind of the carrot, and then there's also a little bit more of the stick, like, hey, if you want to go to Lollapalooza, you need to show proof of vaccine, although I'm sure people are showing fake cards. What do you think? I don't know, maybe Dr. Min, you could start, and Jennifer.
No, it's interesting. I think
Yeah.
that the fact is that we're, as I think Jennifer said, we're in a new world, right? I mean, COVID is not some blip that next year it's just going to be like, oh, did you remember we have now moved into the world of COVID, which is not a disaster, as a number of people have pointed out. There are some pragmatic things that we need to do as a result, and it can adjust because the Delta, like I said, July 4th, Provincetown, COVID was over. But actually, it's not. Delta variant changed the equation. It's not the end of the world, but it means that we do need to take on certain things. I was surprised. Steve and I have been going to the U.S. Open here in New York. They made the decision initially not to require a vaccine in order to attend. And I was like, wow, that seems strange. And then they, did an about face over the weekend, and all of a sudden, and I was there in the lines on Monday on opening day, miles long to get through. But this is the fact of life. To your point, we are going to have to just deal with this. And I think that the important thing is to take those pragmatic choices that allow us to go forward. It's become political, and I'm not going to get into that, but there are just some practical health things that we're all going to have to adjust how we live to some extent. It doesn't mean we can't do the things we want to do. We can have events, we can socialize. It's just that we're going to have to take on certain encumbrances, and that's just the fact of life.
Yeah. Anyone else want to comment on changes you think we'll see and other trends?
I think, one of the things that has happened that's systemic for everybody is we've lost 30% of our industry. And, we can't find those amazing staff. And on one hand, it is wonderful if you're a more seasoned player for you, but it is harder to staff your events, no matter who you are in the space. So I think what we will see, kind of similar to telehealth and healthcare, is we're going to see an acceleration over the next 36 months of event professionals of all walks of life, from event, meeting, hospitality, entertainment, every sector, that are going to be adopting more tools, the ones that make sense for them, so they can do more, so they can book more, so they can take time back. So I do think that as people have taken on the time over the pandemic to really evolve their kind of digital presence, to evolve their speed, I think they're going to do so more because they have to. COVID is this big piece. And even if you do what Ryan does and you take the bull by the horns and you use all the tools, it occupies a lot of your time advising clients. And it's going to be, so the sooner people lean into the tools, the better. And then the sooner we all lean into other efficiencies. tools or otherwise, the
Yeah.
better. So I think that's going to happen over the next 36 months. And I think anybody who isn't doing that by the winter, we're all going to have to do it.
Yeah, I mean, I think on the efficiency side, because I'm a business nerd, I completely agree with you. Being a tech founder here, is that staffs are smaller. You have to do more with less, and efficiency is key. And many people that are signing up with PartySlate let go of their social media person, don't have time to redesign their website, but they can, get all their content efficiently on PartySlate. So we're seeing that same trend. Like, efficiency is really important because you have more mind share on COVID and COVID protocols, and you have smaller teams. So I couldn't agree more. So we have time for a couple more questions. Early on, someone had asked about cost. We talked a little bit about that. So the person that asked that question again, I believe the answer was, roughly ballpark $75 for onsite per person for onsite tests. And Jennifer, I know you have different packages depending on, how big your consumer or your user group is and your vendor teams. So I'm going to send you guys out all of their contact information. I really encourage everyone to learn more and to engage. We know there aren't unlimited budgets, but we also don't want events to shut down again. And I don't think they are going to shut down, but I do think we could start seeing cancellations again if we don't have more people understand that there are new and improved and efficient and proven options out there to host safe events. Ryan, were you going to say something?
Well, it was just a response to what Jen said that made me think of Bob Conti's question earlier, which is, his question was specifically about offsite testing, and, that can be a big lift. And yes, it is. And I also want to say that, when you talk about efficiencies and creating efficiencies, when you, as an industry, when we all have the tools, so when we all know to call Steve, when we all know to call Jen, when Jen's database is filled with 800 industry professionals, meaning all of the planners teams, all of the designers teams, all of the lighting vendors teams, when everyone is already in her system, then all of this becomes easier. It's like the snap. What was once an entire process is now the snap of a finger. So if we all, as industry professionals, start using the tools at our disposal all the time, what was once a lift now becomes something that is just fast, easy, and efficient, because we're doing it and we've done it and we understand how to do it. So it does get easier.
Absolutely. And I also think the more we will share this recorded webinar wide on social media, whoever else wants to see it, but the more educated our event professional, event planning teams can be, the more we can guide our clients to safe solutions. And so we are really proud and thank the Event Doc and VOW Digital Health for partnering with PartySlate. All of our future events in the near future will be using both or a combination to really educate and inform, and also just to experience it firsthand. I think that's the best way, is if you experience it, it's not as scary. Like, oh God, what are my clients going to have to do? And just like fam trips, you go, the hotel, they get familiar with the platform and with testing, it can happen, and we must continue to have safe events. We have one more minute. Anyone last comments, or why don't we just go through final thoughts? Ryan, any final thoughts for our group here?
Well, I was just going to say, you kind of said one of the things that I was joking about in my mind, Julie, which was that, fam trips, those are another thing. The way that we experience new properties, the way that we experience new things together as an industry, those went away too, but now they're back because of Jen and Steve.
Yeah.
People in the industry have been using them so that we can go see new properties, see new hotels, see new resorts and things like that. So it's not just about, it's like, that's also making commerce,
Yeah, it's not just about our clients, it's about our industry, the connections, the networking, and the exposure. Dr. Min, any final thoughts for our audience?
I don't have anything global, but I just want to address one thing that I noticed at some point. Someone was asking about, do you test the vendors and all that? Yes, absolutely. Everyone associated with the event
Could get tested and screened.
Make sure that everyone, in fact, our very first positive that we did find was a caterer, and that was really important. You didn't want to have someone involved in the food preparation who was positive. I
totally agree. Steve, any final thoughts for us?
I just love my collaboration with Jennifer Brisman and also with you, Julie. I just think that as our industry grows and evolves, that we are all learning to, coordinate our skill sets with each other. And I think that that's a wonderful thing for all of us going forward, including what, Ryan and Mark do. So, I thank you all for doing that.
Thank you for your leadership, Steve. Mark, final thoughts.
Yeah, I just think on the event side, on the production side, these services that they're providing are so incredibly important for us. I know that because I've already experienced them, and my team has as well, we feel so much better about going on site and working with certain people. So I really suggest to all of the event professionals, the event designers, the lighting companies, the caterers, all of you guys utilize these platforms, because these platforms are going to make our life a lot easier moving forward. And we want to keep doing events.
We want to keep working, celebrating, definitely. Yeah. Jennifer, any last thoughts before we end?
I think to what everyone said, this is about a time of learning. We learn every day. We screw up every day. I hide under my desk every day. I embarrass myself in front of an organizer every day. It blows my mind how much I see every day. And so I guess patience with all of us. There's obviously other players in the space, other players in the market. Steve and I have been here with each other for 25 years. If we ever thought we would be doing this, neither of us would have believed it, but we're here now, and we kind of need to just keep pushing forward and trailblazing, and that involves learning. Yeah. So I love the support. We're not perfect, no one is, but the more people use these tools, give us feedback, tell us what their needs are, we're building for a whole different future as well. So that's just important, patience and learning. So that's what I take away from it.
Amazing. Well, I am so proud to bring this, learnings and all the experts to our community, and again, share the recording and the article. PartySlate, we really believe inspired events inspire people like nothing else can. As much as I love Zoom, we really believe live events can really connect people to a cause, or celebrate employees, celebrate loved ones. So we want to keep the events world open, and part of keeping the events world open is having safe events. So I really thank you guys from the bottom of my heart for all the hard work you're doing, and anything we can do to amplify your good work and educate people, count the PartySlate team in to continue supporting your great work. So thank you again. Thanks everyone, and we'll send a recording out to everyone. And we appreciate your time.
Thank you.
Thanks, everyone.